Hello, friends, and welcome back to Hope, Health, and Ha-Has. I'm your host, Winny Chan, soon to be National Board Certified Wellness Coach and board member of the Ray of Light Fertility Foundation. And today, we're having a conversation that is long overdue and personal to me and important for millions of people around the world. Pregnancy and fertility issues in Asians, and why we need to talk about them openly, honestly, and with data, not stigma. This episode is for anyone navigating infertility, for our Asian community who has felt unheard in the medical system, and for anyone who has ever felt like their body is the exception without knowing why. So let's get started. I didn't start researching Asian infertility because I wanted to. I started because my journey forced me to. After years of unexplained infertility, back-to-back IVF cycles, miscarriages, and being told over and over again that everything looks normal. Nothing made sense at all to me. I started sharing my story online and something amazing happened. Yes, my Asian community, they came together. Thai, Chinese, Vietnamese, Filipino, Korean, Japanese, Indian women began messaging me saying, "Me too. My results look normal, but nothing works. I keep being told I'm normal, but I know something is wrong." That's when I realized we are not being studied. We are not being representative. We are falling through the cracks. And we're not imagining it. The research confirms that Asians do have a unique fertility challenges. This is where I started digging. And what I found is going to shock you. Studies have consistently shown that Asian couples have lower pregnancy and live birth rates compared to Caucasian couples. In fact, here's what the data shows. The UCSF study shown Asian women has significantly lower IVF success rates, lower pregnancy, and lower live birth rates, even when age, BMI, and diagnosis were the same. And then the CDC ART National Registry shown 26.9% of Asian patients' first IVF cycles resulted in live birth. 34.9% of Caucasian patients had a live birth in their first cycle. And then the clinic data at UCSF, Asians 28.6% delivery rate, Caucasians have 37.5%. This is a big gap. And it's one we rarely even acknowledge or talk about. Why? Well, according to the study, there's a combination of genetic, environmental, medical, and cultural influence. The genetic factors are ovarian reserve differences. Some research has shown that certain Asian women may have lower ovarian reserve, meaning fewer eggs available at a younger age. This is genetic, this is biology. This is why customized protocols really matter. And then there's also balanced translocation. Studies shown that Asian women experience a slightly higher rate of balanced chromosomal translocation. This could lead to miscarriages, failed implementation, and reoccurring losses. This is something that, as we advance in the reproductive medicine, is I hope that there would be more technology in the future where we could actually see what happens after the transfer, what happens to those chromosomes after, and be able to maybe test to see, because although there are genetic testings like PGT and PGTA, the embryos may look good under the microscope, but doesn't necessarily mean after the transfer that they are good. So I can't wait as technology starts to advance, more studies become. I think this might help answer some of these questions for these balanced chromosomal translocation after the transfer, especially with those that failed, like myself. And then in the Asian community, I know that you guys could totally relate to this because many times in the Asian families, we grow up hearing focus on school, focus on your career, make sure you make a lot of money because guess what? If you are poor, your kids are poor, your whole family's poor, you are not going to prosper. Everybody becomes poor. And then we wait till we have kids later because of that. And then also, we don't talk about fertility problems. There is this cultural pressure that often leads to us starting families later because of that, because of school, career, money. And then the result of it is the delay of diagnosis, delay of treatment. And then we don't talk about reproductive health again. So by the time many Asian women seek treatment, their ovarian reserve is often lower, their cycles are irregular, or their hormones are more imbalanced. As an engineer, this is so important to me because I am so data driven, especially in the engineer world. When we create a design, we lead with data. We make sure that the design and what is being produced, the outcome of it matches up to the intent of what it should be. And by that, there is a lot of data testing that is done before anything gets launched. So, in the medical world, I really feel that Asians Americans are one of the least studied group in reproductive medicine because most major fertility studies in the US, they lack that diverse participants. Protocols were historically designed for white women, not Asians, not black women, not Latina women. According to the American Society of Reproductive Medicine and ACOG, both state that they are racial and there are disparities in fertility outcomes. Minority women use fertility treatments far less. Because of cost and stigma and lack of representation, most research does not include enough Asian patients. What does this mean? Well, this means protocols are not customized, they're not studied on us, not optimized for our bodies, and that leads to lower success rates, not because our bodies are broken, but because the system wasn't built with us in mind here in the US. I truly feel that medical residents and fellows in reproductive medicine needs to include in the education of understanding and customizing protocols for Asian patients, understanding the genetic differences, acknowledging cultural differences, and then adjusting medication dosing, you know, based off of how our body reacts to it, applying international research. What can we learn from other fertility clinics that are overseas, especially in the Asian areas like in Thailand, um, in China? Attending conferences with diverse speakers, and then bring diverse data back to the hospitals. And then studying the metabolic differences. This isn't a luxury, this is equality. This is how we stop generations of women from falling through the cracks. When I began researching fertility clinics overseas, especially in Thailand, I learned something so important. They customize treatment for every patient. They don't assume one protocol fits all. They look at the ethnicity, the hormones, the ovarian reserve, the lifestyle, the diet, the environment, and then the stress levels. And many Asians travel overseas for treatment because they finally feel seen, understood, and supported. This inspired me to explore more research specifically on Asian fertility because our stories matter and so does our biology. So, here in the United States, I started looking that up and thought to myself, if I was going to restart my fertility journey again, I want to work with a fertility doctor that understands Asian biology, Asian genetics. because I don't want to do the same thing over and over again, the same protocol in my last 3 IVF cycles that failed. I don't want that. I'm looking for answers and thinking outside the box. I want something different because what was done was not working. And I did find a clinic out in New York, and I found a doctor who is Chinese. Her name is Dr. Luke. She is at Generational Fertility, and they actually have customized fertility plan. And in one of the articles, she actually talked about this of Asians and how in the IVF treatment world is we should have treatment that is customized because everybody's body is different. One size does not fit all. So that really got me to look and reach out to that clinic. And I was really excited to learn about what they had to offer. And it is so different from the normal. And I'll talk more about this in my Instagram page of what they offer and why it's so interesting, and how I'm going to connect this to my coaching program. As you guys know, I am very much data driven. I use evidence based methods to help my patients to understand their hormone, help them reduce inflammation, help them improve their sleep, help them balance their stress, help them heal their mind and body, and support their journey, their fertility journey. And most of all, advocating and teaching them how to advocate for themselves in the medical setting. Because if you don't know what the right questions to ask, you don't know how to ask those, I mean, it's like the blind leading the blind, and that's where I was at. And this is why I'm doing what I'm doing in my coaching program, is to help guide and recommend and support my clients on advocating for themselves and asking the doctors. If you feel that something doesn't seem right, ask them these questions, ask them certain test treatments. And sometimes you don't know what those test treatments are, but that's where I come in to help and be like, you know what? Why don't we ask about this? Why don't we ask for a PRP stem cell? Why don't we ask for, a Dutch plus testing? Because it does not hurt to ask. There's no such thing as dumb questions. And sometimes we have to help guide our doctors. Our doctors know what they're doing, but guess who knows more about our own body is us. And by connecting those two together, gives the doctor and patient the most beautiful experience as we go through the fertility journey, because going through fertility in its own is hard enough. So it's so important to advocate for yourself in the medical setting. And I hope you learn how your body heals when you give it the right environment, mentally, emotionally, and physically. Your body is not your enemy, it's your partner. Sometimes it just needs some help being heard. Thank you for listening to this important episode. If you are Asian or a person of color or someone who has felt unseen in the fertility world, I hope today gave you clarity, validation, and strength. And remember, infertility is not your fault. Your body is not broken. You deserve customized care, representation, and real research. Follow me on Instagram at Winny at KAK and Ray of Light Fertility Foundation as we continue to educate, advocate, and uplift our community. Until next time, stay hopeful, stay strong, keep laughing,